Another question for you, Pa.
Ah.
Because you've now been coming into my practice. I don't have a neurology clinic. I have a regenerative and aesthetic clinic. So it's interesting you talk about degenerative diseases of the brain, of the muscles. I also talk about degenerative aging of the skin, the face, the scalp, the body. You know, it's a form of degenerative skin medicine, isn't it? So that's why we call it regenerative aesthetic medicine. So we're trying to regenerate the skin, the soft tissues, the facial muscles, the scalp health, body tissues, all of those kind of things. So it's a form of regenerative medicine. So now that you've seen, you know I do skin treatments, you know I do skin tightening, you know I do a lot of facial injectables as well. That's the brunt of what I do. Now you've seen this new category of devices that we've been bringing in now for 5 years to regenerate skeletal muscles of the abdomen, the legs, the buttock muscles, the calves, the arms. We now have a regenerative muscle treatment called EMFACE that's now regenerating facial muscle tissues. What did you think when I told you about that?
When I was a student, such equipment never existed. Over the years, when I was doing postgraduate medicine in Mayo Hospital, Minnesota, it also didn't exist. After coming back to Malaysia, I noticed slowly these equipments are existing, but they were of poor quality. I never trusted them. But after going to London the past few years and going to my daughter's clinic for the past 10 years, I regularly visit her and see the type of equipment she has got. They can work faster. But the great advantage is they can work faster, more efficient, more effective. But you have to follow a system. There is a system. Because the person who is doing it must know the anatomy of the facial muscle. Because if she knows the anatomy, she knows the nerves that are supplying the muscles. If she knows the nerves, she knows which part of the brain is being stimulated. So they all interrelated, the brain, the nerve, the muscle. So all three can get stimulated from the brain downwards or from the muscle upwards. It's a two-way process actually. When you make your brain, your facial muscles tight and looking nice, automatically you're stimulating the brain cells also without realizing it.
So that's a really interesting point, because I've had the EMFACE treatment that we brought into the clinic since last November 22. So I've had it, my patients feel it, and immediately after the first session, Papa, everybody feels the tightening, and when I show them their photos, they immediately feel
they react,
re-energized.
Yeah, they feel, because actually their brain cells are being stimulated also. I don't know what's the speed she's stimulating that muscle.
Fast.
I don't know, she calls it fast, but I don't know the speed. So, but all the stimulus goes to the brain finally. But the brain cells are also getting stimulated. So, it's a two-way process actually. And it stays there. That's the best part. But you can't go for one-time stimulation and expect to get the best result. It usually needs like follow-up stimulation. Everything in life is that way. Now, if you have got high blood pressure, you don't take the medicine only for one day. You take it for life till your pressures are controlled.
Yes.
If you need nutrition, you need nutrition for life. You know, if you are earning money, you need to earn money for at least 40 years before you can store it for the next 40 years of your life. Life is like that.
So I've got a long way to go.
Long way to go.
So I just wanted to pick your brain now, because EMFACE is a very new treatment to the clinic. As you know, we've had it only for...
What is it? Yeah.
To treat the muscles of the face.
Oh,
yes?
EMFACE.
EMFACE.
I heard about it.
We're actually talking about this right now, so it's interesting how you're
I saw a
talking
machine
about it.
yesterday.
Yes, you did.
EMFACE.
That's right. So where do you see this impacting patients? Regenerative, where do you see all this going in my practice?
See, there are 35 million odd patients with severe Alzheimer's requiring fantastic nursing help in America. They are hoping to discover medicines eventually, but they have not discovered any at all. Sometimes you start at the top, sometimes you start at the bottom. So we are starting at the bottom. The end point of the nerve is here, in the face. And the face takes a big part of the brain, because throughout your life you are expressing yourself through the face, through your hands. So they move a lot. So now you are telling the nervous system, I am going to stimulate you so that I can move faster next time.
Wow. What are you saying?
So I feel the treatment is not mainly to look nice. The treatment also potentially can stimulate the nerves and also stimulate the neurons and the axons, which are the main transmitters to the brain.
To be continued.
You want to be continued?
I think we'll have to continue this. This is going into a whole new direction.
Yeah.
Yeah.
You've got to ask me questions that I answer.
No, I know. So this one we need to continue because you're really looking at next generation of indication, aren't you?
So at the moment, I've just heard of this EMFACE recently. My daughter has been talking about it, and I've seen her do it to my elder son.
Looks good.
See, I don't plan to do it because I feel I am a bit too old for it.
Never.
And it's costly too.
It's an investment.
All right. Maybe she might treat me free, I don't know.
It's my fault.
Okay.
So I just want to
But
summarize.
I feel it's a retrogressive way to stimulate it backwards. Instead of stimulating the brain and getting the facial move to that way, now you are stimulating this muscle to move the brain cells there.